Good evening, Yorktown. My name is Supervisor Matt Slater here at Town Hall. It is April 15th, Wednesday, April 15th, here to provide you with another update on COVID-19 and its impact in our community. I'm joined by two special guests today. Right over here to my left is Captain Rick Davin of the Yorktown Volunteer Ambulance Corps, and it's great to have you here. I appreciate it.
Good evening.
And on the phone over speaker that I hope everyone can hear is Anthony Milo, who is the chief over at the Mohegan Volunteer Ambulance Corps. Anthony, can you hear us?
Yes, sir. How you doing?
Perfect. We're great. We're great. So I just wanted to, before we let our speakers provide some information to the public, I wanted to just provide some updated numbers and information for everybody at home. Tonight, the number for the town of Yorktown now stands at 313. Westchester County now stands at 20,947. That number is an increase of 756 from the day before. New York State is now at 213,779, which is an increase of 11,571. For those who continue to follow Governor Cuomo, again, I want to thank him for his partnership and leadership during this incredibly trying time. He did provide new executive orders earlier today, one of which I think we knew was coming. And the new executive order that I think impacts most of us has to do with wearing a face covering or mask when going out in public and into certain places where you can't observe social distancing. And this is something that Chief Davin and Chief Milo are going to be able to speak towards, is the importance of social distancing. But for folks who are heading out into the public, and again, we're still emphasizing the importance of staying home and only leaving when necessary. If you are going out into a situation where you can't honor these social distancing parameters, you are now required to wear some type of face covering or mask. Now, we had Dr. Michael Ford from Hudson Valley Hospital join us last week talking about the different types of masks. This is one of the masks here that we use here at Town Hall, and these are being provided to all of our employees. You can also use a cloth mask, which has also been utilized here at Town Hall for our town employees. You can also use bandanas. You've seen people make them, sew them. But again, if you're heading out to the public into a place where you can't observe the 6-foot social distancing parameter, you are required now by the state of New York to wear a mask. I do have just a few additional items, brief items to share with the public. Again, last night the town board had its first video conferencing meeting, so we are starting to get the wheels of government moving again. It was a very productive meeting, and I want to thank the entire town board for all their help and support. And again, I want to thank our town clerk, Diana Quast, for making the video conferencing a reality. Our planning board has already met once, and they're going to be meeting again this coming Monday. They're going to be holding, I think it's 3 or 4 public hearings to move certain projects that are pending approval forward. That information can all be found on the town's website. So the planning board will be meeting again this Monday, and that's going to be done via video conferencing utilizing Zoom. As a reminder, starting tomorrow and Friday, this is from our Refuse and Recycling Department, our R&R staff will be going around Yorktown to pick up leaf bags and Tide bundles. As a reminder, we are asking for a maximum of 12 leaf bags per household and 4 bundles per household. And that's going to help our staff, which again continues to work at 50% capacity. It's going to help our staff get through the entire town over the next 2 days. Also, I want to mention we are starting, and we take these cues again from the President and from the Governor and our partners in government. We are starting to have conversations about life after the coronavirus and New York on pause is lifted. We are putting together a Reboot Yorktown task force, and that is specifically geared towards rebooting our local economy and supporting our Main Street businesses. That is coming together very, very nicely. We have some fantastic members of our community, small business owners, business leaders, the Yorktown Chamber, the Yorktown Small Business Association involved. We have some of our partners in government, County Legislator Vidat Ghashi involved, and we're going to be looking to make sure that the table is set and the town is ready for when New York on pause is lifted so that we can get back to life as we know it. One of the other things regarding life after Corona that I hear often is taxes, and I continue to talk about this, and I'll continue to inform the public. This Friday, the Board of Legislators is expecting to take a vote on a proposal to reduce late fees and penalties for late tax payments. The tax deadline for the town of Yorktown remains April 30th. That is dictated by state law. The town does not have the authority to extend that deadline, nor do we have the authority to eliminate penalties and fees. That has to be given to granted by Westchester County, and the extension, if there would be an extension of the tax deadline, like was done for your income taxes on the state and federal levels, has to come from the state government. That can only be done by approval of the state legislature or executive order. At this point in time, the town has written a letter to Governor Cuomo requesting flexibility in regards to that tax deadline. Those conversations are ongoing. I spoke with the governor's office today. Those conversations are ongoing. But in the meantime, the Westchester County, which does have some purview over those late fees and penalties, is considering legislation that would significantly reduce late fees and penalties to 0.5% for the month of May, 1% for the month of June, and I believe up to 1.5% from July 1st through July 15th. And again, that vote is expected to be taken on Friday, and once we have new information to provide on this matter, we will surely do so so that the public knows what changes may be in store. And lastly, I wanted to, before we let our guest speakers here join the conversation, I wanted to highlight our local food pantries. And earlier today we had Feeding Westchester over at George Washington Elementary School. They every month they've been coming, providing, I believe it's an estimated 250 meals for our neighbors in need. Here in Yorktown, there are other local food pantries for people who are looking to either donate or financially support these really critical services that are in our community. One of which is St. Mary's, which is located up in Mohegan Lake. They continue to distribute on Saturday mornings. It is a drive-through scenario. They provide prepackaged bags that are placed in people's cars. The pantry is following precautions according to the CDC regulations and guidelines. For those who would like to donate perishable goods, there's a box at the entrance to the parish hall. Again, this is St. Mary's Episcopal Church on Route 6 in Mohegan Lake. There's a box at the entrance to the parish hall where donations can be left during the week, or they can be dropped off on Fridays around 12:30 when their volunteers are there to accept them. If folks want to donate money, it can be done on their website, or a check can be made out to the Community Food Pantry and mailed to 1836 East Main Street, Mohegan Lake, New York. And these are, again, critical services that are provided to our neighbors in the greatest need. And my understanding is that they continue to provide well over 125 bags of food every Saturday to the families who are in need. Again, Saturdays the pantry begins handing out bags for those who wish to take advantage. Saturdays the pantry begins handing out bags around 8 a.m. and they close promptly at 11 p.m. 11 a.m. I misread that. So Saturdays the pantry begins handing out bags around 8 a.m. and close around 11 a.m. If you do have questions or if you need to arrange an emergency food pickup, you can call their church office, and that's 914-528-3972. Again, this is for St. Mary's Episcopal Church in Mohegan Lake for their food pantry. To arrange an emergency food pickup during the week, please call 914-528-3972. 3972. Again, for donations, their website is CFP St. Mary's Mohegan Lake.com, and you can donate right online to this great organization who continues to provide food for our most vulnerable neighbors. We want to thank all of our food pantries. We also have the First Presbyterian Church in Yorktown, which we will be highlighting as well, who provides a similar service. So during these times of financial hardship and need, our food pantries across Yorktown continue to exhibit the Yorktown way and provide critical services for our most vulnerable neighbors. And we want to thank them for their service. And with that being said, I want to now bring in Captain Davin and Captain Milo. I can't thank you both enough for what your organizations have done for this community. I know that, frankly, I don't think thank you is enough. And I am a little short on words, only because when you think about what we've gone through as a community and the needs that we've had and the residents who've called in need, your organizations have been there every step of the way. And you've been on the front lines from day one on this, and our entire community is indebted to your service and to your sacrifice. So to both of you and to your members, a genuine thank you for all you've done for us.
Thank you.
Would you like to provide some information to the public about what maybe you're seeing on the front lines right now? I mean,
sure. Why don't I just explain to the public the difference between Anthony Milo's group and mine?
That'd be great.
Yorktown is broken into two districts, two fire districts, and as such, we have two ambulance districts. Anthony Milo and his Mohegan Volunteer Ambulance Crew are basically on the north side of town. Yorktown Volunteer Ambulance Group is on the south side of town. So we are both responding to similar calls. We're both supported by the two medics that are pretty much round the clock here in Yorktown who cover all the calls with us. From YVAC's perspective, our call volumes have stayed pretty much the same. What has shifted is the call volume as far as the makeup of the calls. And we've been running for the past 3 weeks with probably a 60% of COVID-related symptoms on our calls, which we did not have before. And that, truthfully, has come down somewhat, but we are still, and Anthony will tell you the same probably, we're still going to COVID-related symptoms, people who have symptoms and issues COVID-related. So that has not stopped. Bear in mind and understand, when we come to your home, when you call 911, the police let us know if there's has been a history of 911 or COVID-related problems there, so we know. But only one of our members is going to come into your house or apartment or whatever it is. For safety reasons, we send one person in who's got sufficient PPE on for any kind of issue, and then they dictate how much of the crew then comes in as well. So a medic and or one of our crew will come in, do the initial assessment. If the assessment is made that you need to go to the hospital, we will transport you. But what we need to do then is to make sure our members, and we minimize the amount of members, as I said, there'll be one member in the back of the ambulance with you. The ambulance will be pretty much closed up as per state protocols, and we'll take you to the hospital. As a result of, if we have someone who's suspected COVID, when we come back, we have to sanitize and decontaminate that ambulance, the back of the ambulance. So it's for us, without advanced equipment, which we don't have right now, it's roughly a 3 to 4 hour period where we need to leave the ambulance outside, air it out, and then disinfect it before we can put it back in duty. Both Mohegan and us are very fortunate in that we each have 3 ambulances, but we don't like to take an ambulance out of service at any time. There have been times in the last few weeks where we've had one out of service for decontamination and had the other 2 on calls. So it gets critical when we've got all ambulances tied up, and we rely on both each other. Anthony's team sometimes backs us up as we back up them in several cases.
I think, and Anthony, jump in here when you can, but I think one of the key things that you just said that I just really want to hammer home with the public is that we're still seeing coronavirus calls. So I know that the sun's out, and I know everyone is just absolutely at their wits' end with the situation at hand, with this with being forced onto pause with the 100% workforce reduction, but we're not out of the woods yet. And so while we're seeing a plateau statewide that the governor continues to talk about, which is great, we haven't gotten through the tunnel just yet.
No, we haven't seen it in our calls. And Anthony, you can let us know, but we're still seeing COVID-related symptoms on people.
And so for the folks at home, just again, to reemphasize the importance of making those right decisions, of the social distancing, and again, recognizing the social responsibility in those choices you make, because you can still either come into contact with someone or inadvertently spread the coronavirus to a vulnerable neighbor. Anthony, what are you seeing over in Mohegan Lake?
So, thanks, guys. So over here, we are seeing a lot of COVID calls. Dispatch has done a very good job of letting us know what we're walking into as far as before we get there. Well, like Captain Davin said, we do a pre-survey before we get into the house to see if they have any symptoms or we're near anybody that has it. And we are getting a lot of repeat calls. We've had calls in the area for COVID, and we explained to them the proper protocols now, what to do, and we're getting repeat calls to the same residences. So it's happening more and more frequently. So our volume is staying the same. We're a busy department as it is, with well over 3,000 calls a year, and we're still seeing calls come in. People are still calling 911. And, we're just not transporting as much. We're explaining to them how it's not safe for you to be in a hospital unless you're really having severe difficulty breathing or if it's a life-threatening condition that you have. Otherwise, if you're just having the basic COVID-19 symptoms, stay home, isolate yourself, quarantine yourself, keep yourself away from everybody, and that's going to be the safest thing right now. Like you said, with social distancing, that's very important to keep yourself away from everybody, especially if you think anybody that has been exposed to it. We even survey family members, anyone around us. I had a call the other day at a group home where the mother had visited her daughter, and she was COVID-19 positive, and then we had to take her in for an unrelated incident. But still, the fear is there for us, knowing that she could have given it to her daughter, and that we could be exposed to it. So every call we have to be very vigilant and have to be careful because we don't know what we're walking into.
Right, and I know that one of the things that we've been asking people who have tested positive is to self-report. We've talked about the numbers that we provide on a daily basis, that there's still a backlog, that it's not real time, so this is still, we expect it to be roughly 72 hours behind from where we are today. So for those who have tested positive, again, we have requested that you email Chief Noble of the Yorktown Police Department directly to let him know that you have tested positive. That would remain confidential, again, only being shared when there is an emergency at your house to better protect our first responders. And the best way to self-report is to email rnoble, Noble, at yorktownpd.org. And again, it's exactly what Chief Milo and Chief Davin are discussing. This way, when there is an emergency call, if you have self-reported and there's an emergency call at your house, our first responders at least are given the heads up and able to proceed accordingly as to the guidelines and protocols that are put forth.
I think another important part we could ask the public for is if you call 911 and asking us to come to your house, if you have face masks, face coverings, please put them on for your safety and our safety. We're going to send someone into your unit, your apartment, your home. It would be nice for us, for our protection and to keep the air clean, somewhat to speak, is if you have face coverings on. We cannot transport a patient without a face mask on per protocols in New York State. We cannot bring you into the emergency room without a face mask on. So as a courtesy to us, and the medics that come in, if you have face coverings available, put them on before we come in just to help keep the area, keep us safe, to keep anything. There's a chance if the patient has COVID that other people in the room may as well, and it just helps us keep the area clear as well. An important one other thing is if you have elderly or someone who's got a medical condition, is on different types of medications, it's important that when we come in, if you have that information already on a piece of paper. I can't tell you how many times we've lost 5, 10, 15 minutes trying to get someone to tell us what medications the patients are on or what their health history is. If you have the time before, right now, before there's an emergency, put that on a piece of paper. Even if you have children who have that, it makes our job a lot easier when we walk in and the medics can see right away what kind of medications you're on and what kind of health conditions you have on, and eliminates the back and forth, helps them speed up the assessment process, and makes it easier for us to make a determination as far as how urgent your transport is.
That's a great tip. That's a great tip. Awesome. How when you are going to the hospitals, can you provide any information or insight to the folks at home? Because we were very concerned about overcrowding at hospitals. My understanding from my conference call earlier today with the county executive that the hospitals seem to be doing okay from a capacity standpoint. At least the ones in northern Westchester. Maybe not. I don't think the ones in southern Westchester are in the same.
We primarily transport to two currently, Hudson Valley Hospital and Northern Westchester, as well as in trauma cases,
Correct.
we go to the Westchester Medical Center. All three, from my awareness, have a tent set up for overflow right now.
Yep.
Not using it.
But they're not using that.
Not
overflow.
using it.
Right.
But their ERs go in waves. We've been into Hudson Valley where there's not a room available
Yep.
in the main ER, and you're put into an overflow area. It's a very crowded condition because naturally they've moved all the equipment that used to be in every exam room to the outside of the rooms to keep it from being contaminated.
Right.
So to traverse through an emergency room is very difficult right now with even stretchers. They have extra beds in the hallways as well to handle the overflow, and they don't know when it's coming. I mean,
Yeah.
At times we go in there and there's nurses and doctors all over the place, and other times they're waiting in a lull for the next wave to come.
Yep. Okay.
But so they have not backed off in their preparation. They have equipment. They have all their PPE. They're in double gowns when we go in. They have not backed off yet, and they've not seen a drop, so to speak. It's still coming in waves.
And when you and you talked about PPEs, can you? How are you doing with your supplies of PPEs?
Well, we've been fortunate through very many organizations in town. You were very helpful in getting the vendor on Front Street who's supplied us with masks. We've been getting them through the Lions as well. There was a lot of businesses in town, nail salons and other businesses that have donated masks, and we're doing very well as far as the Westchester Emergency Operations Center has worked tirelessly
Yep.
to keep us in gear. So we have not gone out there without gear,
Good.
and obviously our members are all volunteers. We want to make sure that they're wearing the proper gear, and we have the gear, and we've been able to keep up with it. So we're in very good shape right now.
Excellent. Anthony, anything Chief Milo, anything you want to add from Mohegan's perspective?
Oh no, everything that Captain Davin said was on point. Hudson Valley is, especially Hudson Valley for us. That's where we go to a lot. They're very strict with having patient family in there. They're keeping the exposure risk low. So if anyone goes to the hospital, they don't want. We're not taking any family members on board in our ambulance. They're not letting them in the ER. Just to keep the spread from getting worse. And just to mimic what Captain Davin said, we appreciate what everybody's been doing. We've gotten a lot of donations, from you, Matt, and from the town, and everyone keeps turning around asking us. We're getting mystery donations at our doorstep. We've had masks dropped off multiple times. We had another delivery today.
Good.
And Longman has been great in helping us too. A lot of people. It's been really nice that the town has really stepped up to help us. It means a lot, and it's important, and we appreciate. We can't we can't express our gratitude enough for you guys for all you've done for us.
Well, it's the Yorktown way. That's what I've been calling it. Helping each other out during this extreme time of need. But what you and your members have done just goes above and beyond. It really does, and I really can't thank you all enough, again, for your service, for your sacrifice, for answering that call, and putting yourselves in a position where you could potentially be exposed, and same again with your members. But again, we have a great community. I want to thank there's so many people who've really stepped up and we're trying to.
We've got numerous, and I'm sure Chief Milo has the same. BJ's has been tremendous to us. Little Sorrento's, Yorktown Pizza.
Yep.
Heroes for Heroes.
Heroes for Heroes,
And
yeah.
as
from the
Chief
Yorktown
Milo
baseball
said,
team.
people continue to show up at our doorstep bringing meals for our crews. We like Mohegan, run 24 hours a day, and we normally have 6-hour shifts. So we have people on every 6 hours who always cover one meal period, and people have been really stepping up in the last few weeks as far as bringing that in. But I especially want to thank our members. I mean, 60% of our calls right now are running during the daytime hours, which is 6 a.m. to 6 p.m. And we probably have 2/3 of our members are retirees, another third are people who work jobs and work all day and then either ride a night shift or a weekend. And our day shift crews have been really covering the brunt, 60% of the calls. And as I said, they're retirees. They're all in the at-risk categories, over 60, over 65. They have families, they have grandchildren, they have concerns, and they come out with a little, with a concern in their eye, but
Yeah.
they answer the call.
Yeah.
We page out, they answer, and we're really grateful. The town is grateful, I know, and I hope they realize how much everybody is grateful for them answering the calls, middle of the night, during the day. They put the coat on and they go out.
And again, they are volunteers.
Yes.
They are not being paid, and I know it's the same over with you, Anthony. These are volunteers who continue to do this incredible service for their neighbors and in our community. And it's just, again, words can't really. I really have a hard time putting into words just the gratitude that this town has for what you both and what your organizations have always done, but especially in a time and in a crisis like this. It's incredible. So thank you.
Well, I think as Anthony said as well, it started because your support initially. 3-4 weeks ago when this started, you came to us, what do you need? And it's been every day, what do you need? What can I get you?
That's what we try to do.
It's a working relationship that's worked out really well. We haven't seen it this close in the past, and it's energized our members as far as
Well, that's great.
the town board, the supervisor are all behind them and are out there to support them. So really appreciate it.
Well, we're in this together, and again, I just really want to thank both of you and your members for doing so much for our community. And when we're able to gather and we're able to celebrate, we absolutely have all intentions of recognizing all that you and all of our frontliners and first responders have done for our community during this time of need. And so with that being said, we want to, again, wish everyone a good evening. We will continue to provide updated information as it becomes available, as it's validated, to ensure that it's accurate. And until then, be safe, be well, and we'll see you soon. Thanks so much.